I wanted to address one of the really hot topics these days is healthcare costs. And there's just a lot of ideas and strategies, a lot of debate and contention about how do you reduce healthcare costs. And to the best of my knowledge, every way that they thought of reducing healthcare costs comes out of somebody's pocket. So one possibility is to, cut the benefits. Another possibility is to, reduce the pain and suffering in the court system. There's other possibilities that would require the insurance companies to take a hit. And it doesn't take a political genius to realize that if you've got everybody has a stake, that they don't want it to come out of their pocket, you're going to have a hard time arriving at a solution that works for everybody. And with the understanding that that exists in the world now about improving mental health, I'm going to make a case that that is a solution that doesn't come out of anybody's pocket. And I'm going to suggest to you right up front that if you could improve the mental well-being in society, you could save staggering amount of healthcare costs. Okay? And to make this point, I'm going to refer to a study called the HERO study, and it's called the HERO study because it was conducted by a health enhancement research organization. Okay? And it's the first and the largest study that actually looked at what the costs were for specific factors. Now, they have what they call modifiable health risks. And what that means is that there are risk factors like smoking, high blood pressure, but all of the factors they look at are modifiable. That means that people can do something about them. People can stop smoking. People can, diet. So they didn't bother with genetics and chemical factors and things like that. They were interested in what risk factors that are people can do something about cost the most to the healthcare system. So, for example, smoking. Their conclusion, the research showed that the healthcare costs of a smoker was 14% higher than non-smokers. High blood pressure. Person with high blood pressure costs the healthcare system 21% more than the average people with normal blood pressure. Obesity, 21%. Okay? Now listen to this. Stress, people who reported stress, 46% higher than people who didn't report high stress. Okay, the highest number they had, the health risk that was the highest was depression. 70%. So a person who was depressed cost 70% more. Or if they were paying for it themselves, it would cost them 70% more. So of course you have the psychotropic drugs and all that. So you look at 70% for depression, 46% for stress. So if you significantly reduce the amount of depression and the amount of stress, look what that would do to healthcare costs. It would really dwarf the other costs. Okay? So that's one possibility, is you just knock those two down, which I'm saying can be done. That we have the understanding, we have the capacity to lower those. The understanding we have of stress and depression could significantly lower those simply with education. Okay? And I want to talk about what kind of education would lower them. But before I do that, I want to suggest to you that the other items, high items, obesity, high blood pressure, and tobacco, could easily be linked to psychological factors. So, for example, if you talk to smokers, they'll say, well, you know, when I get tense and tight, I smoke more. If you talk to people who have obesity problems, they'll say the same thing. When I'm mentally disturbed, I tend to eat. High blood pressure. The doctors will tell a person, look, you can't get so wound up in your job, you know. It's not good for you your blood pressure goes up. Okay? So even the ones that aren't directly psychological in nature are certainly exacerbated by psychological factors, or to put it differently, would be mediated and reduced by improved psychology in the person. I think it's safe to say that the stress numbers and the depression numbers reflect the fact that this society doesn't understand where stress comes from, where depression comes from, and how to relate to it. Okay? And the biggest way they do it is through the drugs, and the drugs are very expensive. Now, there have been some discoveries about where stress comes from, where depression comes from, some understandings that significantly reduce stress and depression without the need for medication. And I'd like to talk about those a little bit.